The Minister of Health, Dr. Osagie Ehinare, has called for a new public order in Africa that is resilient, adoptable, and ready to cope with any disease threat. Ehinare, who stated this while delivering an address at the ongoing National Council on Health meeting in Abuja, said most nations' health systems were yet to recover from challenges rising from the outbreak of the COVID-19 pandemic. He said the new public health order will help African nations to respond positively to future emergencies and also build a strong, resilient health system with best line of defense against pandemics and any public health challenges.
One of the things we learned there is that a strong, resilient health system is the best line of defense against pandemics and any public health challenge. COVID-19 is still raging, as we can see from reports coming out of China and other countries in the world. So we cannot afford to rest on our oars. But our National Health Sector COVID-19 Pandemic Response Action Plan continues to guide our response as we leverage lessons learned from it to strengthen our health security network. A key lesson is the continental realization by Africa that we need a new public health order that is resilient, adaptable, and ready to cope with any disease threat.
Meanwhile, the Minister of State for Health, Joseph Ekumankama, and other key stakeholders who spoke at the conference harped on the need to reposition the nation's health system to achieve universal health coverage and Sustainable Development Goals 2030 is key for the sector.
Investing in our health system strengthens the path towards achieving USC through a practical primary healthcare-oriented approach. For the administration, healthcare in Nigeria is a right for everyone. The impact of COVID-19 has hampered the administration's efforts to drive us to the next level of UHC, where there should be an increase in health coverage expansion, numerous functional PHCs, adequate distribution of health workforce, and improved budget allocation in health.
Looking at the sub-themes of this National Council of Health, pillars of health systems including primary health care, climate change, strengthening local manufacturing of vaccines and biologicals, big data, digital health, health insurance, and building essential partnerships.
UNICEF is optimistic that this meeting will provide a robust platform to interrogate the sub-themes lined up in discussions, notably primary health care, climate change, and health, local manufacture of vaccines and biologics.
Our success in helping Nigeria achieve these objectives will depend on our joint ability to increase commitments to making the required fiscal and policy reforms that benefit Nigerians, particularly the most marginalized.
Nigeria is very delayed in the last one in terms of demographic transition, and the disease burdens we have not addressed much, but then we get all of these complications. So it means then that this kind of meetings is one where we will need to profile innovative and real-life solutions to make a difference.
The theme of the 63rd National Council on Health is Building a Resilient and Sustainable Health System for Improved Health Outcomes and Universal Health Coverage. Ugochi Obaja, CNA News.